총 물려 뛰는
So this is the lateral one. So lateral one, especially when most of the patient, drooping like this, right? So when they want to lift up here, then you can put the lateral one. This one doesn't have a cope. But how do you think this will give the lifting? Usually when you put the octotrace here, the patient will tell you, oh, I feel like somebody pulling my arm. You see? But it's not a cope which put like this. But they feel the natural fullness, and then something is, they feel like something is pulling their arm. It's very natural, but very effective. And also this one, under the neck. Do you remember last time when I gave you the lecture, I told you do not use the cork thread under the neck area. Remember? Why? What happened usually, the problem? You use the cork thread under the neck. Anybody encounter any problem? If you use the cork thread, especially the cutting cork under the neck, after I told you the full thread 6 to 8 months absorbed, but the cutting cork one about average 4 months, 3 to 4 months, there will be the flash. The weak point will break, and they will be wandering around. You see the sudden protrusion of the thread, especially the skin is thin here. So many cases you will encounter this problem if you use the cork. But the emboss and super emboss will not encounter that kind of problem. So you can use the cannula emboss mode or super emboss mode under the neck area safely. Okay, so here something like this. Usually 3. Okay, we don't go more than 3. 3 for each region. Okay. So today we have so many actually things to show, but too much for one session. Anyway, I will show you here something first. Can you see this deep wrinkle? Can you solve this one with the Botox? Can you solve this one with the HA filler, no matter how hard is the filler? It's impossible. He's more than 70, I think 75 years old, 73 years old, something like that. But if you solve this one with your technique, also very simple, then you will have a lot of patients. Can you see also the wrinkle here? These 3 wrinkles. Most people have 2, but some people have 3. So we also call it Maserati wrinkle. You see the Maserati? The 3 spots? If you remember, I was the first one in Korea, first one in the world use the avatar nose. The one put the filler and become broad. I was the first one use this term. Okay? And also, I was the first one use the V-lifting, V-line in Korea, and at the same time in the world. So we also have many new terms, Maserati wrinkles. Okay, this is a little cane with the epinephrine. I will just go quickly because we have not much time. So just follow the lines and make a puncture. This is a RF cannula. I always show you the RF cannula. Last time I showed here the RF cannula for the eye bag. Can you feel very stiff? Even though it's with RF cannula, you don't think you will do with ordinary cannula. You cannot do with the ordinary cannula. It's very stiff. Even though RF is very difficult to push it. It's very stiff, I tell you. you break all the adhesions by the arc cannula. I tell you, if you remove these wrinkles, you will have a lot of patients after seeing his face. Everybody will tell you, wow, where is your wrinkles? You become so much younger. What did you do? Where did you go? Then many patients will come to your clinic. I told you that I'm using this RF cannula more than 8-9 years already. With this small machine, I earn more than, I think, $1 million already, US. Not 1 million, more than 5 million. Because I'm doing this treatment almost every day. See, very stiff. There we go. Okay, now so after you break this underneath dissection, and this is the octo twist short. Okay, as I mentioned to you, this is what we call thread filler. It's a very simple, very easy. So we have a PDO, PCL. As I mentioned to you, PCL thread is more softer, so it's more expensive. Of course, PCL more long lasting. So have you tried the PCL Hyco thread? You tried the PCL Hyco thread? How long they last? 2 years. Usually even they last 2 years still there sometimes. So up and down. Okay, some people go away after 1.5 years. Some people go away after 2 years. So now 99% of my patients, they all do PCL. They don't do PDO now in my clinic, okay? Especially for the nose, 99% PCL. Also this octo twist long, especially those patients who don't want to, if you put the mono thread on the hypo, they look sometimes a little bit sharp, right? So if you use the octo twist, they don't look sharp. So I place about 2, then they look very natural. So this octo twist has many purposes as well. So can you see? We follow under the wrinkle, we place it. If you just follow the things that I'm doing, your patient satisfaction will be very high. Can you see? Do you think this is due to swelling? After 1 week, the swelling gone, do you think the wrinkle will come back? This will remain, 80% will remain like this. So his forehead become 10 years younger. But of course, this is not the end. You remember, I always tell you, step plan A, plan B, plan C, plan D. So this is like a plan B or C. I do more if they have a more budget. Yes, we always show them A, B, C, D. Sometimes by this, we lower the expectation of the patient. You only do the plan B. So don't expect 100%. This is again our usual machine that I use almost every day. Air dissector. So we take care of the subdermal layer, we take care of intradermal layer, we break it, stimulate the collagen, and the wrinkle will really go away. Usually I treat once like this. I tell them to come back after 1 year, but they never come back because the result lasts more than 1 year. Usually they come back after 2 years, you know. You know this air dissector? I think some of you have this air dissector machine. only air. The needle, only 30 kg needle, very super cheap. You know, I charge one night, $100. See, but because no other people have this kind of treatment, so and but very effective. So the price you quote is the treatment price. Actually, for me, the minimum 1 centimeter, $100. If I treat like this, $500 per line, because I can get rid of it almost 80%. You know, nowadays you should have something which other clinics doesn't have to survive. Okay. So we mix with our booster. We have have you heard about the PDRN? PDRN. Have you heard about PDRN? It's very famous in Korea. Hyaluronic acid with PDRN, the RNA nucleotide regeneration substance. Oh, have you heard about Regeneron here? Regeneron is a PDRN, but it's very expensive. We have boosters with the hyaluronic acid, with the PDRN and many other peptides, and so this is the one we shoot after this air dissection. It's a very reasonable price, so many of our doctors happy to use it. And we shoot after the air dissector, we create the space in the intradermal layer, and then we shoot the booster. Okay. Because here, especially, we add some more stronger peptide called the acetylhexapeptide, then the wrinkle will improve a lot more than usual. So on top of the PDRN HA booster, we add on the acetylhexapeptide cell toxin booster, I mean the product, so the wrinkle will disappear more than the usual treatment. So this is like our plan D treatment, A, B, C, D, 4 things together. Now more better, right? His son is a very famous actor in Korea. So now he's already more than 4 months, and he was so happy with the forehead. So these are the kind of a treatment. I will go a little bit quickly. This is the octo twist for the forehead. Okay, the lidocaine. Usually we put 5, okay? On the middle one, on the inner, outer, in between, so we put 5. And we make a puncture inside the eyebrow, so we will not leave any scar, okay? So this is a long octo twist. We have 2 sides, long and short. It's a so hold it tight and shake a little bit out. So she has a little bit thick skin, she's okay, but some ladies with a very thin skin avoid octo twist here, but you have to use only the mold, okay? So you hold tight when you remove it. You see, the thread came out, so you have to hold tight, okay? I'm also making some mistakes sometimes, of course. So hold it tight. Push until the end, hold it tight. Shake a little bit. But while you are going in, don't shake too much. I mentioned to you, okay? This is a very common mistake of many doctors who are using the cannula. You're doing like this, and then the bevel goes up, then you get the trouble. So you have to minimize not minimize. You should not have any trouble. It will cause you a lot of headache, disturb in your practice if some patient coming in. You stop, have to talk to her more than 1 hour to convince. Okay, so I will go a little bit more quickly. So you put 5 here. Okay. Also after 1 month, 2 months, 3 months, the result is more better. And lateral forehead. The one who's drooping outside, okay? Lateral side drooping. So actually you can use the plasma, you can use this octo twist. It's a very good combination. I will go more faster. Okay, this is again 45 degrees up, okay? 45 degrees means up, lateral, in between, okay? 45 degrees, okay? And do not put on the protrude bone area, below the bony protrusion area, okay? When you go lateral side. Remember, okay? If you put the protruded area, it will look prominent, okay? So when there is a protrusion, right below the protrusion. Remember that one. And push until the end, okay? If you can place the thread somewhere here, it's much better. I mean, half inside the hairline is much better, okay? It will not be prominent on the forehead. Please remember, okay? So octo twist, PCL. There's so many uses of the octo twist. Push until the end, hold it tight and take it out slowly. Okay. Bevel down, please take a look at much more closely. Bevel down, push until the end and take it out slowly. Just follow the instruction, then you will not have any trouble. But if you don't follow the instruction, you will get into many trouble. Because I've been doing uncountable cases, I want you to minimize trouble, especially when you are using our thread. Okay, this is the border. Next one we have fold with the octo twist. Entry point, injection, marionette injection. But always remember also, entry point should be superficial injection, okay? Don't put subdermal, lidocaine, nothing. It should be superficial, epidermal, or intradermal, okay? So puncture with the 18G. This is a PDO octo twist. Bevel down. Superficial 3. We put 5. We put 5. 3 superficial. Okay, superficial, can you see? And also make sure you hold tight. So usually 1 and the one in the middle, 2, and here 3. And the 4, 5 in between, but in a different layer, deep layer. So 1, 2, 3 superficial, 4, 5. You got it? And it will be very natural, okay? And of course, some people is too deep or too heavy fold. Then we can add also HA filler, but I use only 0.3 cc or 0.5 cc. But you minimize the filler, which you are putting. This is a deep layer, okay? Which you are putting 1 cc on each side, which will definitely cause you the migration, okay? So this will help less migration. Also the marionette line, if you put too much filler, sometimes your marionette line become very here, unnatural with the fillers, but with the thread will be very natural. Here marionette usually 3. 2 superficial, 1 deep. Okay, and we put the hyaluronic acid fillers. This is also very good quality with a good price. So many doctors are using it now. Okay. Okay. So use the cannula all the time for the fillers. I use only 0. I think this one 5. Yeah. You always have to make sure even, okay? Okay, so this is the, again, superficial, 3, 1. So this is the auto twist, again. And I will go to the other one, we lack of time. Just quickly. And this is about under the neck area with a super embossed PCL. The starting point is right below, 1 centimeter below the most prominent jawline. Okay? Actually, those who already trained by us, you know this line is the baseline. So from the baseline, 1 centimeter below, then you start putting 3 super embossed. Then you will have a beautiful jawline after some time. Okay, so I will just go past. I will show you something. There are many patients who place a lot of filler. This patient put HA filler 4 times because after some time, 3 months, 4 months after, it becomes broad. So she put 1 more time, become broad, put 1 more time, and become like a bulky like this. There are many patients with this broadening after HA fillers, okay? So we use the RF cannula, very simple, very easy. I tell you, if you go under training just once, you will tell me so easy, okay? Because it looks aggressive.